Bismillah ar-Rahman ar-Rahim. These questions come from Dr. Ihab regarding to guidelines for withholding and discontinuing resuscitation. When can I discontinue resuscitation? Depend on according to current regional outcome and prognosis, because the prognosis and outcome is different from international to national to regional areas. Even is different from hospital to hospital, from institution to another institution. Based on the outcome or regional outcome and the prognosis, I will categorize my patients to major categories: uncertain prognosis and certain prognosis. Certain prognosis, this means I know the prognosis, and uncertain prognosis is mean I don't know the prognosis. So certain prognosis, if I know the prognosis, this patient indicated to resuscitate, or another is not indicated to resuscitate. So resuscitation is not indicated in 3 conditions: in extreme prematurity, confirmed gestational age 22 weeks, anencephaly, and some major chromosomal abnormalities such as trisomy 13. Why you are not going to resuscitate this age group or these categories or these conditions? Because no chance of survival, incompatible with life, because this major lethal abnormalities incompatible with life. So this is palliative care, comfort care, compassionate care. The other group, it is resuscitation, is nearly always indicated in babies with gestational age 24 weeks and those with most congenital malformation. But this malformation actually is compatible with life, but not major lethal abnormalities. So I have to resuscitate this group of the patient or condition of these patients. So certain prognosis, so I know the prognosis, either I resuscitate or I indicate to resuscitate or not indicated to resuscitate. The third group, this is uncertain prognosis. What is the meaning of uncertain prognosis? This is condition associated with uncertain prognosis. Survival is borderline and morbidity rate is very high, and the anticipated burden to the child is very high. What are going to do in this age group or these categories? I have to support the wish of the parents for initiation of resuscitations, and also I have to tell them I will modify my decision based on the condition of the baby in the best interest for the baby. If the best interest to resuscitate, I will resuscitate. If the best interest for palliative care, comfort care, or compassionate care, I will go in the palliative care or comfort care. So in summary, the patient between 22 to 24, this is uncertain prognosis. Less than 22 weeks, this is no indication for resuscitation. These 3 conditions, I will not resuscitate the baby. Less than 22 weeks and anencephaly, trisomy 13. Why? Because incompatible with life, no chance of survival. Between 22 to 24, actually this is a gray zone, we call it uncertain prognosis. I have to support the wish of the parents for initiation of resuscitation, but I have to tell them I will modify my decision based on the condition of the baby or the best interest for the baby. If the best interest of the baby to resuscitate, I will resuscitate. If the best interest for the baby to palliative care, I will do the palliative care. If the baby more than 24 weeks, I have to resuscitate regardless the wish of the parents or not regarding to the wish of the parents. شكرا. سلام عليكم.